welcome back for the tip of the week. I am Dr. Shannon Shea of Learn ABA with Dr. Shea, and this is for the group BCBA Resources. What we're going to talk about this week are the pros and cons of being a BCBA, specific to working in nonprofits, because that is the industry I've worked in for my entire career and the one I know the most about. And there's some tricky stuff, but also there was a really good thread this week on pros and cons of being a BCBA just in general. So what I'm talking about are the pros and cons that I have found for myself and some areas to be careful about when you're working specifically for nonprofits. So let's get started. All right, the pros, and I'll try not to list a billion of them to keep the video short-ish. Number one, I love what I do. I really, really do. I enjoy behavior analysis so much, and I don't think there's anything I like more than just sitting with a client and working with them, because in that moment when I'm running programming or I'm doing an assessment or trials or whatever, I'm just connecting with them and in the work, and selfishly, like, I forget about everything. And it kind of just, it goes into that flow state that people talk about, that they always try to get to in business. If you talk about like life hack kind of people, right? So it just makes me really happy. I find a lot of reinforcement in working directly with clients, and I enjoy it and I look forward to it. The second one is I have never gotten bored with this career, ever. Anything else I've done, any other career paths, I would like learn about it and be really excited, but then at some point I'd be like, okay, I've mastered it and I kind of know everything, and then I would get bored and change into a different field. ABA is not that way, because like, how do you run out of what humans do? And even if you do, you can go to animals, right? Like, there's so many subfields to work in and different ways to use ABA. You can work in early intervention with autism, which is not something that I've done tons of, but I have done organizational behavior management consults. I have worked with traumatic and acquired brain injuries. I've worked with intellectual and developmental disabilities. I have worked in medically fragile homes, so people with IDD, intellectual developmental disabilities, who are also medically fragile and had different and very specific needs. And for that, I did a lot of work with hospice and with nursing. And that's just like some of the stuff I've done. And now I'm a professor. I don't do as much direct clinical work anymore, and that's really fun and a new thing to do. I got to like write my own VCS and behavior program. So I've never been bored, and there's so much to do that if you get kind of disillusioned with like your subfield, or it's just been like 10 years and you need like something to reinvigorate you, the opportunities are basically endless. And I think that's amazing and wonderful and fascinating. But also, I just love the science, and it's always exciting to me, and I see it everywhere I go, every minute of the day. I still get excited every time I get a new issue of a journal in the mail. I just came back from ABAI, and that's reinvigorating, also exhausting, but super fun. Let me know if any of you guys were there. I had a great time, but I got this book, which I'm very excited to read. And it's more of what I do. I kind of specialize in treating psychiatric disorders with behavior analysis. And that's kind of what the nonlinear contingency analysis is about. And it harkens back to Israel Gold Diamond. I'm getting on a tangent and I will stop. I love this stuff so much. So yeah, as you can tell, I get excited. I love it. The science is just so cool, and it's pragmatic and it's effective and it works. And you can see it working. So like, you know what you're doing has an impact, and that is amazing to me. And also, I just have met so many amazing people. Like, I love my colleagues. I love my coworkers. It's a really, really, really good group. They're very, very, very rare that I would meet a behavior analyst and be like, oh, I don't like them so much, right? Like, we're pretty cool people, I think. So those are the pros, like the major pros. And again, this is specific to, tired from the conference, specific to nonprofits. The cons, I think, are even more specific to the nonprofit world, but as far as I can tell, it also happens a little bit in the insurance world. For those of you that do like early intervention and do a lot of billing for insurance, let me know in the comments if the stuff I'm talking about that happens in nonprofits is as true for you guys that work in for-profit corporations or do that kind of thing. So the first con of nonprofit work is that I was, and still am, because the university I work for is a nonprofit, really overworked, like really overworked. And when you're dying and you can't keep going and you're telling like your boss or whoever that like you need help, you need something, you need more money, like whatever it is, less hours or more pay for like the amount of work you're doing, you get all of this pressure to like work all these extra hours because you care, right? It's about the client, it's about the individuals, and like you can't fail them, you can't let them down. So if you don't work those extra hours and make it happen, you're failing this person. That is dangerous, and it's a good way to get burned out. And I was a supervisor, clinical director at nonprofits for many years, and I used to try really hard to like help my staff manage this and not to do this to my staff. But like people care a lot about the mission and you do want to help. However, if you're working for an organization that assigns you an impossible caseload and you can't maintain your own health and life, and give your clients the treatment that they deserve or need, that's not your personal failing. That is the organization you work for. It's not an excuse to slack or anything like that. But I mean, if you're really overloaded, what happens a lot is you'll just get guilted into working 80 hours a week every week until you burn out. And that's how people leave the field. That would have been amazing behavior. Like I've seen it happen, like great BCBAs that just burn themselves out because they care so much. So basically it's your client you're seeing. You have ethical obligations to them. If you have more work than it is possible for you to do, not just like in a busy month, but like on a regular basis, talk to your clinical director, your supervisor, whoever, and just say this isn't manageable. And if you can't get everything done, don't beat yourself up too much. You didn't assign yourself the caseload, right? So like, don't internalize that is what I'm trying to say. Like try to make sure everything is done and good. Advocate for people getting the resources they need. If you're not able to do that, don't guilt yourself into trying to do more than you possibly can, because it ends up in burnout. It ends up in making a lot of mistakes that you wouldn't have made. It goes sideways, and I've seen it happen a lot over the years. So that would be the biggest con that I could think of, honestly. And I think that's true no matter what your position is in a nonprofit environment, is just everyone cares so much and the mission really is important, but also it's your job, right? Like they're your clients, not your actual family members, and people get over-invested and then there's blurred boundaries and burnout and all kinds of problems. The second con would be regression. I work mostly with adults, so I've not been like severely injured, but it's possible. So I think that's a con. For me, it's never been like enough for me to even consider not doing the work I do, but other people might feel differently. But I have, on a few select occasions, just like been covered in bruises or had furniture thrown at me or get my hair torn out, bites, that kind of stuff is not ideal. It's unglamorous. So I would say that's a con. The other con that I could think of, and it's the only one, is right now there's a huge movement, not huge, but there's a very loud movement of people saying all ABA is abuse, ABA is inherently abusive, it's conversion therapy, this, that, and the other. I published a paper about conversion therapy and behavior analysis and our history with it. I just did a 3-hour workshop at ABAI a few days ago about that and how to recognize the signs of basically like people in good faith saying, I had early intervention and these are the parts of it I feel like were inappropriate or not so good that need to be changed, versus internet trolls, because there's both. We want to make sure we listen to people for social validity purposes that did go through ABA therapy and had concerns or parts they didn't like that's the responsible thing to do. And we want to make sure we're not trying to change behaviors that are inappropriate to target for change or in inappropriate ways. So we do want to hear what these people have to say, but it's taken on a life of its own. And there's a lot of questionable comments sometimes, or people who are just arguing and saying it's all abuse that aren't interested in learning or engaging in an actual discussion. So that can be really demoralizing, because again, we get our hair torn out and we get furniture thrown at us and we love it and we work so hard. And then you go on Reddit or something and you hear like everything you're doing is abuse and you're some kind of a monster, and people use like really hostile language, and it's hard to hear. It's growing pains for our field. It needed to happen. It's something that we should absolutely go back and re-examine, and I'm doing a lot of work to make that kind of like louder, but in a productive way. There's a large number of people who are screaming about it, and it's not productive, and that can be demoralizing. And when people are complaining about a thing and you're doing the best you can, but there's nothing you can do about what they're saying, or they're not willing to discuss, it's just ABA is abuse, no further argument, that can feel really bad and can be really demoralizing. I've seen people be or post on Reddit like, should I even be a BCBA? I really, really wanted to do it. I thought I loved ABA, but now I'm here, it's abuse, and I'm afraid. So I think that that's one of the cons. I also think it's something our field needed to go through, and in the end, it'll have been a good thing that this was happening. But right now, in this past 6 months, year, it's a hard time. So those are the pros and cons for me personally, and what I've seen as a direct clinician at BCBA, like assistant clinical director. It's what I've seen with my staff when I was a clinical director for around 10 years. Let me know if you had the same experiences, different ones, and let me know how similar or different it is if you work in for-profit or bill insurance, because I've not done that and I'm curious to hear. So if you want to see more things like this, please remember to subscribe or like the page, depending on what platform you're on, and I hope to see you next week. Thanks so much.